Hey guys, it's Conrad in the making. So over the past few days, the Republicans dished out their new healthcare plan to repeal and replace Obamacare. It's confusing. There's a lot of similarities, a lot of differences, and frankly, there's a lot of news outlets that may be biased or, hard to understand. But give me a shot. I'm going to run through the stuff and we'll try and get it nailed down before it's over. So why am I talking about this? Healthcare is a huge issue. Not only does the legislation affect the people that are getting healthcare, but it affects hospitals and healthcare providers. So I think it's important to understand what the legislation is, what the big points are, in case you run across a situation where you may need to know that knowledge. There's a lot of things that the new healthcare plan, it kept from the AHCA, the Affordable Care Act. There's a lot of things that's changed, so we're going to run through it real quick, and at the end, we're going to run through a score that the Congressional Budget Office gave it. They kind of ran the numbers, how many people are going to change in their insurance habits, and how is this going to curb the deficit, how are premiums going to be affected by this new legislation. So we're going to run through that, and we're going to see how it all works out and wrap it up at the end. Bear with me, the legislative process takes a long time. Things probably changed during this video, so just keep that in mind while you're watching this. Alright, let's run through what the American Health Care Act kept from the AHCA, Affordable Care Act, otherwise known as Obamacare. First thing I have is that people can still stay on their parents' plan until the age 26, which is extremely important. The next thing I have, the Affordable Care Act was transferred over to the American Health Care Act, is the pre-existing conditions are still covered. You still have protection under those clauses that insurers can't deny you coverage for pre-existing conditions. Also, there's still no lifetime dollar amount cap for insurance coverage. Under the Affordable Care Act, what they took care of is that insurance companies often put a lifetime cap on how much money they were going to provide for a certain person over a period of time. And they said, no, we're not going to do that anymore. There's not going to be a cap. And that transferred also over to the American Health Care Act. And one of the last big things that I have as far as similarities goes is that there's still tax credits available for those to have health insurance, but they're not determined by income anymore. They're determined by age, which has huge differences and huge implications for those trying to get their coverage. Alright, the similarities are all great, that's cool that all that transferred over, but a lot of the discrepancy between both parties and legislation comes from the differences, obviously. The first big one I have is that the American Health Care Act got rid of the employer and the individual mandate to get insurance, right? You won't be required, you don't want to have to pay a penalty by not getting insurance. With that said, there's some other things in there that still incentivize you to get insurance, but we'll run through that later. Another big difference, this is a big deal among lawmakers, is that under the Affordable Care Act, Medicaid was going to be expanded, but now under the American Health Care Act, it's going to be slowed and eventually halted in a few years down the road. One of the biggest differences under this new legislation is that it's no longer requiring what Obamacare called essential health benefits. What this was is that it required insurance companies to take care of certain parts of care such as pregnancy, ambulance services, hospitalizations, mental health, and certain prescription drug things. What this essentially means is that insurance companies have the ability now to determine what they want in their own insurance packages, right? So if you're even protected under the clause that says, pre-existing conditions still have to be covered, if you don't have a healthcare plan accessible or cheap enough or affordable enough to provide for it, then that protection is essentially useless. A lot of people are concerned about this because they're afraid that insurance companies will now just strip down their packages to the bare minimums of care, and those that need pregnancy care or mental health care or certain, other expectations, they're not going to be able to find a plan that suits them, or essentially not one that's affordable enough. Also, even though there's no individual mandate to get health insurance, the caveat to that is that if you're uninsured for, I think, around 2 months or so, and then you go back to insurance, there's going to be like a 30% charge on your premiums for that year. So that does definitely incentivize you to keep insurance. It's not going to penalize you for not having it. It will penalize you for getting it once you don't have it. This piece of legislation also affects hospitals. Under law, hospitals have to care for those in emergency services that are not insured. And so under the Affordable Care Act, this kind of lightened the load for them, because since everyone was mandated to get insurance, everyone was supposed to have it, they no longer went to hospitals' emergency care services as a last insurance resort. Under the American Health Care Act, though, what's happening is that they're getting rid of the individual mandate, so a lot of people are afraid that these hospitals are also going to have a higher load on them for people going to get care because they don't have insurance. The CBO, otherwise known as the Congressional Budget Office, they ran the numbers for this healthcare plan. They do it every time a new piece of legislation comes up. And they determine the numbers as far as how many people will lose insurance and what the cost is, or what the reduction in cost is going to be for the federal budget. So let's run through that real quick. One of the things the CBO said about this new piece of legislation is they said that 14 million people by the next year are going to lose insurance. This is due to many things. People feeling as though they're healthy enough they can take the risk as to not buy insurance because there's no mandate to buy it anymore, or because a rise in premiums will go up and that will in turn cause people to not purchase it. Also, over the next 2 years, they said or speculated that premiums are going to rise by about 15 to 20% during the years 2018, 2019, but by 2020 they're going to start to decline. And by declining, they said about 10% by the year 2026 or so. They should be lower than what it is under current law. Even though this new healthcare bill gives more tax credits to the elderly and less to younger people, the CBO speculated that under this new legislation, insurers are now going to charge about 5 times more for healthcare for older people than they will for younger people, relative to 3 times more under the Affordable Care Act. Before we wrap it up, I got another question for you. Throw it in the comments if you get a chance. What I want to know is, what is your greatest concern about this new legislation? What would you like to see in it? There's still processes going on. They're still going to add stuff, take stuff away from it. What would you like to see in it, and what is your greatest concern for it? Remember guys, healthcare is a huge issue. There's so much more to this bill than what I covered in this episode. There's going to be so much more added and taken away, but ultimately what's important about it is that it influences how we provide care. It influences those we are providing care to. So don't take it lightly. I'm Conrad. I'm in the making just as much as this healthcare bill is. Stay strong, keep the community. I'll see you next time.